Hello and welcome to Health 247 on Rapid TV, your trusted window into the world of wellness, healthy living, and life-changing medical insights. I am Josephine Bitrus. On this edition, we turn our focus to a growing crisis that goes beyond hospitals and clinics, one that strikes at the very foundation of health itself, food and survival. Across Nigeria, millions of families are struggling to put meals on the table, not just because of rising costs at home, but also due to shrinking support from the global community. Health experts agree that hunger is more than an economic issue. It is a medical emergency, from malnutrition and weakened immunity to increased maternal and child mortality. The consequences ripple across society, threatening an already overburdened health system. Let's get started. Nigeria is facing one of its most severe humanitarian moments in recent years, as economic pressures at home collide with shrinking global support abroad. Rising food prices, conflict-induced displacement, climate shocks, and widespread poverty have already left millions struggling to survive. Now, a sharp decline in international humanitarian funding is worsening an already fragile situation. Against this backdrop, the United Nations warns that up to 35 million Nigerians could face hunger as global donor contributions dry up and aid agencies scale back critical food and nutrition programs. The development raises urgent questions about food security, government capacity, and the human cost of global economic uncertainty, especially for children, women, and vulnerable communities. Nigeria is facing a severe food crisis with nearly 35 million people projected to face severe food insecurity from May to September 2026. The UN has warned that nearly 35 million Nigerians are at risk of hunger in 2026 due to a collapse in global aid budgets. This includes 3 million children facing severe malnutrition and 15,000 people in Borno State facing famine-like conditions. The crisis is driven by a combination of factors, including insurgent attacks and instability in northern Nigeria, particularly in Borno, Adamawa, and Yobe states, have disrupted farming and access to markets. High food prices, inflation, and reduced humanitarian aid have exacerbated the situation. Floods, droughts, and other climate-related shocks have impacted crop yields and food availability. From a nutrition perspective, the UN's warning means millions of Nigerians are at risk of both not eating enough and not eating well, leading to widespread undernutrition, micronutrient deficiencies, child growth failure, weakened immunity, and long-term damage to health and development even before famine-level starvation occurs. Nutrition International's country director for Nigeria, Dr. Osita Okonkwo, went on to explain.
It means that 35 million Nigerians are at the verge of being exposed to reduced nutrients uptake in all ramifications. Also means that some 35 million Nigerians will not meet their nutrient need on day-to-day basis. It means that we will also have children, pregnant women, who may suffer some unwarranted ill health because of poor nutrition. It means that Nigeria is on the verge of higher incidence of malnutrition, higher incidence of undernutrition, and of course higher incidence of poor nutrition attainment. So what that means is that Nigeria is still not able to meet its target for the global nutrition target for Nigeria in 2030. So I think it's a call for major intervention both by government and by development partners.
The UN's warning about severe malnutrition among Nigerian children poses a significant health risk, both immediate and long term.
If you understand what it means when a child is faced with malnutrition and how that will affect the cognitive development of that child, if you understand how it will affect the overall capacity of that child when he grows to an adulthood, if you understand the consequence of disease that the child will be exposed to, talk about measles, that would affect the cognitive development of that child, you will know that it's a big challenge for the country and for the people of Nigeria. It also means that we are looking at children who will not be able to, meet their cognitive development to adulthood, to become productive adults. It means that we have pregnant women who might have deliveries that would be preterm or produce stillbirth, or even prematurity or low birth weight children, or sometimes small for gestational age children. Or some of them may also have severe complications and may be prone to bleeding, severe bleeding and anemia caused by malnutrition in their pregnancy. That makes the pregnancy outcome to be a major concern. So it shows you that there is a lot of issues both in the short term and in the long term. So what it means is that the government also needs to pay attention. The communities need to pay attention. And the families also need to pay attention. So it's a major challenge for the country. Looking at the short term, looking at the long term involvement on the development of the child. And of course, our desire is for every child born healthy must also grow healthy to attain their full potentials, and the government will make huge savings on that investment. And that is why it's important to have this conversation around nutrition investment, both by government and by partners. And I think that is very important that these questions are being asked and that solutions should be sought to ensure that every pregnant woman goes through very healthy pregnancy and produce healthy outcome for children, and those children are encouraged, provided the nourishment they need to grow and nourish, and then be able to become productive adults.
In what areas have Nutrition International invested in Nigeria for the nation to overcome the burden of malnutrition?
Yeah, at Nutrition International, we have been investing in nutrition for the past 30 years with the support of the government of Canada. We have been investing in micronutrient deficiency interventions, which is where we help governments and individuals to overcome the burden of micronutrient deficiencies. Key among them is vitamin A deficiency, which of course had a huge impact on the cognitive development of the child, resulting to stunting, underweight, and of course issues of poor development. So we invest in procuring vitamin A supplement for children, which should be administered to these children at the age of 6 months, twice a year until they turn to 5 years. So regular administration of vitamin A meets the need of that child and help to protect the child from the intercurrent illnesses that it may be exposed. And we encourage government to also be able to support the process of getting this child to accept vitamin A. In Nigeria, this is distributed through maternal newborn child health weeks twice in a year, May, June, November, December periods. And we support that process at the national level and also across states. That is a very huge investment. Nearly over 90 million capsules of vitamin A are shipped into Nigeria through our partner through our support to our partners like UNICEF to ship them into the country and distribute, while we procure them at huge cost to the Canadian government. Then we also work with governments in states to address issues around diarrhea in children, which is also a major drain on their nutritional status. So, we ensure that every child who is exposed to diarrhea within 24 hours must receive appropriate treatment using zinc oral rehydration solutions, which are made available to health facilities, and we'll also train the health facility workers on how to identify these children and provide appropriate care. Also train the caregivers at home how to identify the signs of diarrhea in the children, and then immediate action they should take to refer the child for care. So these are also very life-saving, low-cost interventions that have been proven over time to support children with diarrhea and reduce exposure to malnutrition in those children. Those are very key. And then in the side of the mothers who are pregnant, make sure that we are dealing with anemia in pregnancy, which has a far-reaching implications for the woman if untreated or rather unsupported. So what do? You screen the woman and ensure that they receive iron and folic acid. But currently, because of the discovery of multiple micronutrient supplementation, we are doing operational research, or rather nutritional research in Bauchi, where we have identified what government need to do to ensure that women who come to health facilities are given multiple micronutrient supplements, which contains up to 15 micronutrients that will help the woman to pass through seamless pregnancy period and help to grow the baby healthy. And we have a lot of reports on that children of mothers who have received very good care and then appropriate supplementation with MMS comes out healthy at birth with appropriate birth weights. And then issues of low birth weight, preterm delivery, birth, and of course even postpartum hemorrhage do not occur in those children and in those women during pregnancy and delivery. And that is what we have been promoting recently in Bauchi and then across other states in Nigeria, helping the government of Nigeria to develop a roadmap and then costed plan for them to roll out and train healthcare facilities workers on administering MMS. Meanwhile, in the course of our research in Bauchi, we develop all the tools required to implement these tools. That means registers, monitoring and tracking tools, and also even empower community members to help the women, identify the women who are pregnant, to come early enough at the health facility and receive this care. And then those tools have been adopted at the national level for the government of Nigeria to use to train healthcare workers to be able to have the capacity to identify women who need to be taken care of during pregnancy using multiple micronutrient supplementation. And of course, in the course of that research also, we're able to get to identify how government can use last mile deliveries processes to take commodity from the warehouse at the state level down to the health facility level in a way that makes the facility to be able to have adequate stock of commodities to meet their needs. So those are system strengthening opportunities that we have provided for government, and we've done it more effectively. And that is just on the side of service delivery. And then coming to issues around making adequate resources available for government to use. We're also working at the national level with the National Assembly. The Committee on Food and Nutrition has been empowered through capacity building by our organization to identify the nutritional need of the country and make appropriate investment to it, so that government of Nigeria will no longer depend solely on the support of donors and partners to be able to provide the required nutritional need of its people. So working with the National Assembly Committee on Food and Nutrition, we're able to produce capacity building tools and then framework that can be used by the Assembly to identify areas in the budget annually that requires more investment by government into nutrition and be able to appropriately invest in those areas, making sure that government has adequate resources to be able to address issues around malnutrition. And Office of the Vice President, similarly, will be able to identify what it means to track investment, track outcomes on nutrition, and then helping the Vice President office to also be able to have a compendium of what is required to be done to build the capacity for monitoring and oversight, as well as providing leadership for nutrition investment in the country. So there are a lot of work to be done. This work at the National Assembly is also being scaled down to state assemblies to help states also to be able to make appropriate budgetary allocations for their states to address local nutrition issues. Now that government is launching the N774 initiative, this is also going to help the state government to provide appropriate oversight through the state assemblies to the local government that will implement N774 initiative that will address malnutrition down to the grassroots, ensuring families, communities are appropriately engaged in addressing issues around malnutrition, providing adequate information for them, and then mobilizing them to take action that are community-led and community-based, which we feel will make nutrition interventions more appropriate and more targeted to the people that need them most. We're also working with government of Nigeria to look at how government can begin to look at what is more appropriate for it to invest resources on. We have what we call the cost of inaction tool, a tool developed by Nutrition International globally that you can have access to on the website, where government can plug in and see what an investment of $1 in nutrition can mean over time. That report shows that if you invest $1, you are getting a reward $26 return of investment. And that is very important for government to know that for every investment done, there is a reward. And that reward is more than 26 times double what the investment is. That is really very, very key. So now, what that translates to is that for children under 5, the government needs to invest in breastfeeding for those children from the day of birth to when they are at least 6 months exclusively, and ensure that mothers continue to breastfeed and transition to complementary feeding thereafter, after 6 months, to 2 years. We also encourage women to breastfeed up to 2 years because, like breastfeeding is also a form of contraceptive at that early stage of pregnancy, of delivery. Then we also encourage that when the child is 6 months, government should also invest in ensuring that maternal and child health weeks are held continually as expected. The problem we have currently is that some states do not hold their maternal and child health week when it's supposed to hold, so that the children will have access to vitamin A, supplementation, deworming, and other interventions that are provided for them. So that delay affects subsequent campaigns because campaigns should be between 4 to 6 months apart and not more. But oftentimes you find campaigns that are more than 6 months apart. So all that means that the vitamin A that the child has taken the previous 6 months would have elapsed, and there will be a lacuna before the next one comes. So we want to have sure that every state has a fixed timeline for their own state campaigns that will be recognized, because oftentimes in the course of our post-event coverage surveys, we've also observed that most people or caregivers complain that the reason why they were unable to present their children to have access to vitamin A is because they are not aware of the campaign. It's either that the campaign date were changed and they were not aware, or there were not adequate mobilization to let them know of the date the campaign had been fixed. But if there are consistent fixed dates, just like what we did when we were fighting for polio, when we had fixed a particular period in the month for polio, and everyone knows that is the day the polio immunization will happen, and nobody puts any activity that period. We need to have states commit effectively in identifying periods within that May and June that works for them, that they can fix for their own campaigns, and gazette it in their laws and policies, so that no one would determine again any day they choose to have the campaign. And those campaigns will be fixed And parents will know over time that this is the days when the campaign will hold and be able to present their children for the campaigns. This is very important. We think that this is a very key step the government has to take to be able to address the issues of poor access to vitamin A and other nutrition support during maternal and childhood that the children need to be able to overcome malnutrition.
Reduced global funding for nutrition is already putting critical nutrition programs at risk worldwide, with serious implications for public health, especially for children, pregnant and breastfeeding women, and vulnerable populations in low and middle income countries.
Yeah, I think looking at that, I mean, the 515 million as 16 million being proposed by the UN, the OCHA, UN Organization for Coordinating Office for Humanitarian Affairs, OCHA. I think they are just being, very realistic and factual. $516 million is not a small amount of resources, but it also wouldn't go too far if you look at what the country needs at the moment. Issues around malnutrition for the population also has to do with availability of resources, of nutrient-rich meals. When the food are not nutrient-rich because of inadequate fortification of those condiments, there is still a risk. So I think that the drive to make appropriate, fortified, nutritious meal available for families. In the face of scarcity, there may be investment in making those resources available to be able to procure and then distribute. So where the families are not getting enough nutrient-dense food, then there is also the possibility that there will be unmitigated malnutrition, as the case may be. And looking at issues around insecurity also, we also feel that beyond all that's being done, improving the security situation in the country will also help farmers to go back to farm and actually farm and produce nutrient-dense food that people will buy and consume. So these are also issues that the government may have to pay great attention to. But beyond that, the support that OCHA would provide will also have to ensure that families are able to have access to this nutrient-dense food once they are made available. But I think that's also very critical that those should be made available as well.
Given the funding constraints, government and health agencies should promote breastfeeding, complementary feeding, and healthy eating practices.
Nourished meal requires being able to look at what kind of food locally made available and can be resourced. Every community has what works for them, but being sure that people are able to get the food they need in a well prepared manner that has opportunity for diversity in the meals, covering the appropriate nutrients that are required. But of course, with high cost of food items in the market, which is obvious, there's likelihood that it will also affect the volume and quantity and quality of food people consume. So invariably, there's also need for government at this point to also consider what kind of support they will provide for families that are struggling to ensure that they have equal access to the short meals, because it's the right of citizens to be healthy and well with support of government.
With only $560 million to reach 2.5 million Nigerians, the focus must be on prioritizing life-saving nutrition actions, especially in the northeast and northwest regions where the mortality risk is highest. Thank you for staying with us. To address this crisis, governments and health agencies must urgently expand access to ready-to-use therapeutic foods and other essential nutrition commodities. Health facilities and nutrition programs should be strengthened to improve the early detection, treatment, and management of malnutrition. In parallel, agricultural initiatives food distribution programs and social safety nets must be scaled up to ensure vulnerable populations, especially children and pregnant or breastfeeding women, have consistent access to nutritious food. Sustained domestic and international funding is also critical to support nutrition services and emergency responses. Additionally, promoting exclusive breastfeeding and appropriate infant and young child feeding practices alongside training and deploying community health workers to identify and manage malnutrition cases at the community level will be essential to saving lives. And that does it on this week's edition of Health 247. Tune in next week for a fresh package. Until then, eat well, stay healthy, and take care.